Good morning. Good morning. I'm Nosoluwasheyi, and today I promised us earlier we'll be talking about osteoarthritis. Osteoarthritis. So when we're talking about osteoarthritis, what do we mean by this? This is the inflammation of joints, inflammation of the joints, and this happens as a result of there is a place where two bones meet, which is called the joint. So at that area, there is always a cushion, which is called cartilage. And that cartilage, when it starts to wear out, or it's not as much as it's supposed to be on the bone, covering the bone, then osteoarthritis, we can say osteoarthritis as setting. And at that point, then the bones begin to rub over each other. And what are the symptoms that you see? One of the major symptoms is pain. There will be pain around that area. The area will be inflamed, in short, swelling or inflammation. Then the third one is stiffness. There might be stiffness. The person is trying to walk and the person cannot walk well. So these are things, the three cardinal signs of osteoarthritis. We have two types of osteoarthritis. We have the primary and secondary osteoarthritis, and for the primary one, is the one probably that was inherited by an individual, because of genetic factor. A person can inherit some conditions, so that can be the primary. But for the secondary, this is caused by a trauma. Probably a person had an accident and the joint was affected, or a person had an accident and did not attend to that particular accident. No matter how small, when we fall, especially elderly people, please, let's pay attention to falls. Falls is not good for them, and that is why the accommodation where they stay should be friendly, elderly friendly, for the geriatrics. And that is why we're talking about the trauma. Like if a person is traumatized or has an accident that affected a joint, that can lead to secondary osteoarthritis. So how do we treat osteoarthritis? It can be treated depending on the cause of that osteoarthritis. If it's the condition that we know that, okay, I am prone to this, maybe due to genetic